use heart for action, what we mean is that we, as every individual of this country, but every individual across the world also, has to be responsible for prevention of heart disease, for bringing action through regulators, through policy makers, through our own companies, through around us, through our families, through any sphere that we are a part of, to act to bring down heart disease and the scourge of heart disease.
As we all know, every year we celebrate World Heart Day on the last Sunday of September. This is mainly to increase the awareness of heart disease among the common man. And every year we have a special theme. And this year we have a special theme that is Use Heart for Action. So basically we want the people to be aware of the heart disease and take steps to prevent and treat the heart disease without much delay.
If the artery is short, straight and not much of calcium, especially which is seen in younger individuals, the absorbable scaffolds are a good solution. Whereas elderly people who have got calcium, the artery is tortuous and it collapses repeatedly, there the metallic stent is a better option. Whereas a small artery which should not be put with a stent, diffusely diseased artery is a better candidate for a drug-coated solution. So there are different indications for different modalities, but yes, they can coexist in a particular patient and patient can benefit from all of them.
World Heart this year is prevention is so much cheaper, prevention is so much better, and prevention of course is superior. If we as Indians, especially the youngsters, take it to our heart, 150 minutes of cardio and gym exercises per week, and that's not a lot. And of course, curtail junk food and curtail on eating outside. So my message to our society is protect yourself from heart disease by leading a disciplined life. Healthy eating, healthy exercising, and of course, then you have healthy hearts. And then you can perform your best for not only the country, but towards your own self and of course the family.
The way we are doing the surgeries and with the way we are dealing and looking at the heart disease. As we are discussing about the robotic surgery as well as the minimal invasive surgeries, it has got tremendous advantage that the incision is less, the pain is less, the blood loss is less, and obviously the ultimate goal is the patient can go back to their productive lives much earlier and much faster. So normally in a normal conventional surgery, people believe that they will be, kind of a bedridden for 3 months or so. But with the robotic and minimal invasive surgery, they can just go back to their work in 2 to 3 weeks' time. I have my patients who have undergone valve surgery, they go back to their office's work after 3 months or after 3 weeks, and then they are back to normal.
It is a global initiative by the World Heart Federation to raise the awareness about the cardiovascular disease and promote the heart health. Its importance lies in the encouraging healthy heart habits like to increase the exercise or importance of the balanced diet, increase intake of the fruits and vegetables. It also includes the spreading knowledge about the prevention of the heart disease.
As Indians or South Asians, we are already predisposed to, means genetically we are poorer than European countries. And as our lifestyle that is not suitable to us, basically we are following the Western lifestyle. And being genetically weak, following Western lifestyle. And if you take males are more common with coronary artery disease, females are little bit resistant to coronary artery disease till they are menstruating. Means till the age of 40 around, they are little bit less incidence of coronary artery disease in them. But now the demographics are also changing in young population as the lifestyle and smoking, that high stress, then drugs like cocaine, everything. So in younger population also we are getting coronary artery disease or heart attack.
When you ask me the causes of aortic stenosis, it depends on the age. Previously it used to be rheumatic, but these days rheumatic fever, especially even in our country, has come down. So it is no longer a significant contributor to aortic stenosis. The commonest is degenerative, which generally occurs in the elderly beyond 65 years of age. Number 2 is some people are born with only 2 leaflets. Normally the aortic valve has 3 leaflets. But by birth, a proportion of population have only 2 leaflets which degenerate fast. That is called Buerger's periodic vein. There are certain other causes as well. In certain parts of the world, it could still be rheumatic, which is a consequence of involvement of the heart valves due to rheumatic. It was initially recommended for the higher risk surgical patients and then for intermediate risk patients. And you can actually consider this for even low risk patients.
Aortic stenosis, typically has 3 cardinal symptoms. The most common symptom is patient feels breathlessness on exertion. When he walks, he feels out of breath. That's number 1. Second, he could feel pain in the chest, tightness in the chest, or heaviness in the chest on walking on or exertion. So that is the second symptom. And third is he may feel dizzy, he may actually faint, what we call as syncope in medical language. So exertional fatigue, exertional syncope or fainting is the third symptom. So these are the common 3 symptoms. That is breathlessness, chest heaviness or chest pain, and fainting on exertion. So, the awareness of TAVR as a therapeutic option is still very low. People normally think, that, when we talk of aortic stenosis in an elderly, it's surgery. And nobody wants a surgery at the age of 75, 80, 85. And nobody wants, and also doctors also, surgery is an extremely high risk in this subset of age in these patients.
Yeah.
So TAVR, being a relatively non-invasive procedure, is the treatment of choice in most of these elderly patients. So, spreading this awareness is of paramount importance. As of now, it is still very low. Once this awareness spreads, then we'll have more patients who will be willing to, take or avail of this, therapy. They can lead a much better active life. Another reason why people, they are not, this disease is not diagnosed is, most elderly, especially in our country, are not physically very active.